Hello, I am Dr. Joseph, and today I want to talk to you about something I see every single day in my practice, something that genuinely worries me. If you or someone you love wakes up regularly with a dry mouth, that sticky, uncomfortable feeling like you've been chewing cotton all night, please, stay with me. What I'm about to share could truly change the way you see your health, and by the end, you'll understand exactly why this matters more than most people think. This symptom that so many people dismiss as a minor annoyance of aging is actually one of the most serious warning signals your body can send. No, it is not normal, and it is definitely not harmless. As a doctor, I've seen too many older adults ignore this signal, and the consequences have been devastating. Behind the dryness hides a real danger, a direct link to serious conditions like aspiration pneumonia and infections that can put your entire health at risk. But here is the good news. Understanding the danger is already the first step towards stopping it. I'm not here to frighten you, I'm here to wake you up, and I'm going to give you a clear, precise action plan so you can start protecting yourself today. Let's begin with the hero most people never think about, your saliva. Most of us assume saliva is just water, right? Just a fluid that keeps things moist. That is a costly mistake. Saliva is one of the most complex and precious fluids your entire body produces. Think of it not as water, but as a personal army working around the clock to protect you. First, saliva is the immune guardian of your mouth. It is filled with compounds that fight bacteria, viruses, and fungi. Every time you swallow, you send a cleaning wave that carries millions of dangerous germs toward the acid of your stomach, where they are destroyed. Without enough saliva, those microbes go nowhere. They stay, they multiply, and they throw a very dangerous party inside your mouth, turning it into a perfect breeding ground for infection. Saliva also contains enzymes that begin breaking down food from the very first bite, supporting digestion and the absorption of nutrients that become so critical as we age. And here is perhaps the most important role of all. Saliva is a master lubricant. It allows us to speak clearly, chew without pain, and above all, swallow safely. Try swallowing right now, feel how smoothly it happens. Now imagine trying to swallow a piece of bread or meat in a completely dry mouth. It's like trying to push a boat through a desert. The food doesn't form that compact, slippery ball we call a bolus. It sticks, it breaks apart, and that is where the path to disaster begins. Saliva also constantly bathes your teeth with calcium and phosphate, repairing microscopic damage from daily acid attacks and helping tiny wounds in the mouth heal. A dry mouth is a mouth that cannot heal itself. The medical term for this is xerostomia, and it is not just a feeling, it is the real, measurable disappearance of your guardian, your digestive aid, your lubricant. When this protector vanishes, especially at night, your mouth is left defenseless, transforming from a balanced environment into a biological war zone. That pasty dry feeling you wake up to is the siren announcing that your defenses have fallen. Ignoring it is like silencing a fire alarm because the noise bothers you, and I know none of you want to do that. Now before we go further, if this is already opening your eyes, I encourage you right now to subscribe to this channel and hit the notification bell. Every week I share clear, direct health advice that can make a real difference in your daily life and the lives of the people you love, and you don't want to miss a single one. Let's now unmask the real causes of morning dry mouth, because this is rarely one single culprit. It is often a perfect storm of factors working together against you. Cause number one is the most common offender I see in older adults, your medication cabinet. More than 500 medications, many of them incredibly common, list dry mouth as a side effect. And the problem multiplies because many older adults are not taking one pill, they are taking 5, 10, sometimes more. We are talking about medications for blood pressure, antihistamines for allergies, antidepressants, muscle relaxants, Parkinson's medications, the list goes on. These medications are often necessary, but they frequently interfere with the nerve signals that tell your salivary glands to produce saliva. They simply block that communication, and the saliva factories slow their production. I remember one patient, a gentleman of 78 named Pierre, who came to me desperate, unable to eat or speak comfortably. We reviewed his medication list and discovered that a diuretic for blood pressure combined with an antihistamine had created a desert in his mouth. After speaking with his other physicians and making a small adjustment, his life completely changed. Never let your medicine cabinet become your enemy. Cause number 2 is the nocturnal thief, mouth breathing. While you sleep, you should be breathing through your nose, which is designed to warm and humidify the air. But if you breathe through your mouth, whether due to congestion, a deviated septum, or a serious condition like sleep apnea, you are asking for trouble. 4 hours, dry air passes continuously over the moist surfaces of your mouth. It is like leaving laundry out on a windy day. By morning it is stiff and completely dry. The same thing happens to your mouth, and the little saliva you do produce evaporates almost instantly, creating paradise for the most dangerous bacteria. Cause number 3 involves diseases speaking through your mouth. Sometimes dry mouth is not a side effect but the primary symptom of a condition urgently needing attention. Diabetes is the classic example. Poorly controlled blood sugar affects the entire body, including the salivary glands, and elevated glucose in the saliva itself becomes food for bacteria. Then there is Sjögren syndrome, an autoimmune disease where the body mistakenly attacks the glands that produce moisture, including salivary and tear glands. It is more common in women over 40 and often goes undiagnosed for years. Other conditions like Parkinson's disease, rheumatoid arthritis, and nerve damage in the head or neck can also dry out the mouth. Cause number 4 comes down to daily habits that cost you dearly. Chronic dehydration is a silent epidemic among older adults. As we age, the thirst mechanism becomes less reliable. You can be dehydrated and not even feel it. If there is no water in the system, the body will not waste it on saliva. And of course, tobacco and alcohol remain 2 of the most damaging culprits. Smoking dries the mouth and damages salivary glands. Alcohol is a diuretic that dehydrates the entire body. Coffee, tea, and cola sodas can also contribute. Now let's talk about what this actually leads to, because this is where things become very serious. Aspiration pneumonia is the most acute and frightening risk connected to dry mouth. It is a lung infection that occurs when food, liquid, or saliva goes down the wrong path and ends up in the lungs. Without enough saliva, food is not properly lubrified, loose, dry particles form during chewing, control during swallowing is reduced, and those particles are loaded with dangerous bacteria. In a younger person, a strong cough reflex might expel the particle, but in an older adult with weaker muscles and a less robust immune system, the particle stays, and the infection spreads. I have seen patients in intensive care fighting for every breath from aspiration pneumonia that began months earlier with a simple complaint of dry mouth. Beyond the lungs, a mouth without saliva becomes a feast for cavity-causing bacteria, not ordinary cavities but aggressive root decay attacking exposed tooth roots as gums recede. From there, bacteria inflame the gums, then destroy the underlying bone, becoming the #1 cause of tooth loss in older adults. And a bleeding gum is an open door into the bloodstream. Bacteria can travel through the entire body, and science links this to increased risk of heart disease, stroke, and even Alzheimer's. In the worst cases, a severe dental infection can trigger septicemia, a life-threatening chain reaction. Everything can start with a dry mouth. There is also the quieter damage, the malnutrition and social isolation that follow when eating becomes painful. People stop choosing nutritious foods that require chewing and turn to soft, processed options, accelerating muscle weakness, immune decline, and a vicious cycle of deterioration. And chronic bad breath brings shame, difficulty speaking brings frustration, and many people quietly withdraw from family meals and social gatherings, a kind of invisible loss that steals the joy from their later years. But here is my personal rescue protocol, the steps I share with my own patients. Hydrate consistently, not in large quantities but in small, frequent sips throughout the entire day. Set a reminder every 30 to 45 minutes if needed, and always keep a glass of water on your nightstand. Maintain impeccable oral hygiene. Brush at least twice a day with a soft bristle brush and fluoride toothpaste using gentle circular motions. Use a tongue scraper daily, floss every night, and rinse with warm salt water instead of alcohol-based mouthwashes that only make dryness worse. Stimulate your salivary glands by chewing sugar-free gum or candies containing xylitol, a sweetener bacteria simply cannot digest. Eat firm, fibrous foods like apple slices, celery, or carrots. Create a nighttime oasis with a cool mist humidifier in your bedroom every single night. The change you will feel in the morning is remarkable. Massage your parotid glands, the largest salivary glands located in your cheeks just in front of your ears, using gentle circular motions with 2 fingers for 1 minute twice a day. Review your diet and habits. Limit coffee, tea, sodas, and alcohol. Avoid very salty or spicy foods. And if you smoke, let this be the signal that finally moves you to seek help to stop. And most importantly, call your dentist today. When you go, say these exact words: "I wake up with a dry mouth and I am concerned about the risks." Also bring a complete list of every medication and supplement you take to your doctor, and ask directly whether that combination could be causing your dry mouth and whether alternatives exist. Waking up with a dry mouth is not a sentence, it is a warning, and a warning only serves its purpose if you act on it. Dr. Joseph reminding you, a healthy mouth is the first step toward a long and full life.